So my name is Tuan Ha. I'm a radiation oncologist in Queensland and the newly appointed Dean for 25-26. I started my radiation oncology training in Queensland and have done 9 years of clinical practice, both in regional and metropolitan centres. I've practiced both in public and private setting. Currently, my practice is based in Brisbane, and I look forward to being the Dean for the next 2 years to help facilitate the strategic plan of the college. I think every specialist milestone is to attain fellowship, and I was lucky to achieve this in 2015, being admitted to the College of Radiologists as a fellow in the Faculty of Radiation Oncology. Subsequent to that, building a practice and being able to facilitate the care that we were trained for in regional Australia in both Hervey Bay, Bundaberg and Rockhampton has been the highlight of my career to date. The care that we can provide both in metropolitan and regional centres is vitally important to the trust that the communities have in the oncology sector, and being able to facilitate the care closer to home for patients was a highlight of my career. We know that 1 in 3 patients won't access radiation therapy if the facilities aren't close or local. Being able to deliver this in regional Australia has been key to more patients accessing radiation therapy and more patients being cured or alleviated of their symptoms caused by their cancer. One of the most rewarding moments of my professional career so far was co-convening the 2023 Brisbane scientific meeting for the college. It was great to work across the faculty of both clinical radiology as well as radiation oncology. All the hard work that the conveners as well as the staff at the college put together, and to see it come to fruition as the most successful ASM ever the college has held has been one of the greatest highlights. It was very fun and interesting to see all the working parts of the college come together in Brisbane to see more than 1,600 delegates come and learn what the college has been doing, but also our colleagues both locally and internationally from a research and leadership position. I encourage anyone who has an interest in research to submit your abstract to the 2025 ASM to be held in Melbourne. I think volunteering is vitally important, and it provides us with an opportunity to directly contribute to causes that we care about. We're able to build meaningful relationships, both internally and externally to our careers. I volunteered for college out of initially curiosity as to what the college does, and the more I volunteer, the more I understand that it is a member organisation and our voices are vitally important. Outside of college, I also have been a volunteer scout leader, and this has given me life skills, especially around knots and looking after children. I also volunteer for St John's Ambulance, which has allowed me to be able to provide care to the community, both at sporting events, but also when disasters happen, like in 2011, the Queensland floods. I was able to provide care for the workers who were doing the cleanup. This allowed me to receive a Queensland Disaster Medal, Disaster Hero Medal. And it's one of the key highlights of my volunteering time. I look forward to being able to facilitate and listen to our members as the Dean of the college, which is also a volunteer position. Balance of both work life as well as volunteering is complicated and hard. I would not be able to do it with the support of my team here locally, both my secretariat staff at my practice as well as the college. Also, I must not forget my family, who are very supportive of my roles. My wife does encourage me to spend all my time not dilly-dallying about and using it for useful purposes such as volunteering, and hence why I'm such an advocate for volunteer jobs, especially for health professionals as well as community projects. The balance requires a lot of sacrifice of some things that I might find enjoyable, such as reading, a little bit of downtime, but it does enrich my life significantly, being able to provide education for young Joey Scouts or providing healthcare to community volunteers. I've volunteered for the college for almost 9 years, and one of the proudest moments is being part of the Targeting Cancer committee. This committee allows for education both for medical professionals as well as the wider community. Being able to espouse the benefits of radiation oncology, its benefits to our community members, both patients who are afflicted by cancer, but also their families, providing education on the benefits to other medical professionals has been key in the increase in utilization of radiation therapy over the last few years. I look forward to continuing investing my time in updating Targeting Cancer, but also educating our fellow medical colleagues as well as improving the education standards for our trainees.